Welcome back again. Today we are going to discuss one another important polycrest remedy, which is a Rhus Tox. The monsoon is here, and the most useful remedy in this period of time is a Rhus Tox. In this session, we are going to discuss what are those points which suggest us that this patient needs this remedy. So, the Rhus Tox is a plant remedy which grows in North America, flowering in June. In 1798, it was first used as a medicine to cure a hepatic eruption since years that was accidentally poisoned by a rust plants. So what does it mean? That there was a person who is having a hepatic eruption since a year, and this patient gets accidentally poisoned by a rust plant, and they get cure with the hepatic eruption. So this remedy having a accidental proving, and after that this remedy comes in our practice. After that this remedy comes in a homeopathy. So this was the first time this remedy has been used. The peculiarity of the rust plant is that it is more poisonous during night or bursting into the leaf or at any time at June and July when sun is not shining upon it. तो इसका मतलब क्या है कि ये जो प्लांट है वो ज़्यादा पॉइजनस होता है नाइट में, जब इसको पत्तियाँ फूटती है, जब इसको नए पत्ते आते हैं, एंड इन द पीरियड ऑफ जून एंड जुलाई, जबकि बाहर सूरज की रोशनी कम होती है, बादल होते हैं, डैम्प वेदर होता है, ऐसे समय में ये प्लांट ज़्यादा पॉइजनस होता है. सो इफ़ वी लुक इनटू दिस मोर closely, and if we relate these modalities or this characteristic of the plant with the patient, we found that there are many patients who told us that they get aggravation into in a night period, they get aggravation in a damp weather when there is an absence of a sun. So the modalities of the rust ox patient and the characteristic of a rust plant get matched with each other. The absence of sunlight and dampness together seems to favor the exhalation of the toxicodendric acid. मीन्स व्हाट कि ये जो प्लांट होता है इसमें एक टॉक्सिकोडेंड्रिक एसिड नाम का एक पॉइजनस एक्सट्रैक्ट होता है जो कि ज़्यादा एक्सेल होता है, जो कि ज़्यादा वे से अफेक्ट करता है पर्सन को व्हेन देयर इज एन नो सनलाइट एंड व्हेन देयर इज एन डैम्प वेदर. जो रस्ट प्लांट की पॉइजनिंग है वो बस उसको टच करने से ही नहीं, इफ द पर्सन पास फ्रॉम द दैट प्लांट, if the person goes from that nearby from that plant, then also they get affected with the poisoning if they are susceptible to it. मीन्स व्हाट कि जो टॉक्सिकोडेंड्रिक एसिड है वो इन फेजेस में ज़्यादा तरीके से अफेक्ट करता है. मीन्स जब नाइट हो, जब जून जुलाई का पीरियड हो, when the absence of the sunlight, जब सूरज नहीं हो, एंड when there is an damp weather outside, इन सब परिस्थितियों में ये ज़्यादा अफेक्ट करता है पर्सन को भी. एंड this thing we also found in a Rhus Tox patient, in which the symptom of that patient get aggravated in this period of time. In these scenarios they get worse of their symptoms. Dr. Henneman given a keynote of a rust patient. The severest symptom of suffering are excited when body or limb is at a rest. Means what? The modalities of the rust ox patient, and more than that, the characteristic modalities of the rust ox patient is that they get aggravated when they at a rest phase. Means if they having a rheumatism, means if they having a any psychological symptoms, if they having any asthmatic symptom, they get aggravated their symptom when they stay at a rest position. And when they start moving, when they start wandering, they feel better in a generalized level, means they feel better for the rheumatic complaints also, asthmatic complaints also, and even a psychological complaints also. They get feel better when they move around. Okay, so the above symptom is totally opposite to the bryonia. In bryonia, the person get aggravated when they start moving. The person get aggravated when they continuously walking, and they get amelioration by the rest. They get amelioration by the pressure. So these both remedies are having a opposite symptom, opposite modalities. They are inimical to the each other. The greatest rigidity and pain experienced on a first motion in a morning, and the joint after rest, and the waking up in the morning. Means what? The greatest rigidity. हमें पता है कि if we seated for a long time, we can't able to move so quickly. So this type of thing happens in a Rhus tox patient, that when they seated for a long, when they slept at a night, and when they get up in the morning, they get a rigidity in their limbs, they get a rigidity in their spine, or whatever part that is affected in that patient, that get rigid. And after moving that particular part, or after moving on a very first moment, they get the aggravation of that symptom. And whenever they start moving continuously, whenever they start the his day to day activity, they feels better. So many of the patient, Rhus tox patient, tells us that when they get up in the morning, when they rise up in the morning, they get aggravation of their symptom, and after the day going, they feels better. When they're doing their work, when they're doing the daily day-to-day activity, they feels better. So this is again shows us that they feels better while moving, they feels better while working, and there is an aggravation of the symptom when they at a rest phase. So presence of the restlessness is a leading indication of a Rhus tox in a fever, typhoid, and others. The restlessness is another characteristic of the Rhus tox patient. It is one of the trials of a restlessness. This restlessness is generally at a both level, means at a mental level also and a physical level also. Means what? When there is any symptom, they get move around. Even if the mental symptom, even if there is anxiety, even if there is an fear, even if there any physical symptom also, they get restless. They restless at the both the level, means at the mental level also and the physical level also. This is the characteristic of the Rhus tox patient. Now the Honeyman pointed out another keynote of a Rhus is that the most efficacious and specific remedy for the fatal effect of overlifting, incoordinate exertion of muscles, and a contusions. Okay, so this remedy is a very well acting remedy in the cases of fatal effects of overlifting, incoordinate exertion of the muscles, and contusions. So ये चीज़ हम स्पॉन्डियोलिसिस के साथ कोरिलेट कर सकते हैं। मैं ये चीज़ हम एनी रिमेटिक सिम्टम के साथ, रिमेटिक डिसीजेस के साथ कोरिलेट कर सकते हैं। हमें पता है कि जो रूरल एरियाज होते हैं वहाँ पे लोग who don't know about the proper lifting of the objects from the floor, and after many years, when they started getting pain in their back or spine, or in arms and legs, they get to know that there is an fatal effects of the overlifting. Means बहुत समय के लिए एक भारी चीज को उठाते उठाते, जो वर्कर्स होते हैं, जो मजदूर होते हैं, जो फार्मर्स होते हैं, इन सब लोगों में ये चीज बहुत कॉमनली हमें देखने मिलती है कि आफ्टर मेनी इयर्स दे start getting this rheumatic symptom, and this is the all effects of the overlifting. This is all the fatal effects of overlifting, and due to this overlifting they get the diseases like spondylosis, rheumatism, or any osteoarthritic disease, they get developed. So in such type of cases, we can definitely use the Rhus tox as our important polycrest remedy if the other characteristic of that remedy get matched to the patient symptoms. Now the rheumatic symptoms are generally aggravation at a rest, aggravation at the first moment, aggravation on the ascending stairs, aggravation on the lifting. So if we search the lifting aggravation, we found the Rhus is for around, I think, 3 marks. Okay. When the patient is at a rest phase, they get aggravation of the rheumatic symptom. When they start moving on the very first moment, they get the worsening of their symptom. And when person stepping up the stairs, then also the symptom gets aggravated. Now the amelioration of the all these symptoms are by movement or the continuous motion, amelioration by a hard pressure. So generally what happens in the many rheumatological cases, we found such modalities that the patient feels better after a hard pressure. If we ask the patient that how they get feel better for their pain, this tells us that I used to press the that affected part by someone or by anything. And if we ask them, is there soft or hard pressure they get prefers, so they usually tells that hard pressure makes me feel better. And in this particular modality, we found there is a minimum remedies, and this is the important symptoms we found in a many of the patients. Okay, so in this particular symptom, we found the Noxomica also, we found the Rhus Tox also. So there are many such remedies which helps us in this particular symptom. Now the most important and important modality again in a Rhus Tox is a hot application amelioration. In a Rhus Tox patient, the more they takes the hot application, more they apply the hot application, more they feel better for the affected part. And we know that in a many of the arthritic or many of the osteoarthritic patients, rheumatic patients, we found this symptom that they used to hit the part affected part, and they used to feel better from that. So many of the patient tells us that when they are taking a bath, they used to put hot water on the affected part and they feel more better. So more the hot uh, the water is, the more they feel better for that particular part. So this is again an important characteristic for the Rhus Tox patient. And there is one more most important symptom we found in Rhus Tox is a cracking joint ameliorates the symptom. Means what, the generally Rhus Tox patient have the habits that they usually breaks the joint, they usually jerk the hands, or they usually bend the necks, and they usually cracks the joint. And after cracking that or after that sound, they used to feel better for the pains, they used to feel better for the rigidity. And this is the habit that start getting into the that particular patient, and after that they feels better. Okay, so this is the important characteristics of the rheumatic patient in a Rhus Tox. These are the modalities of the Rhus Tox patient in a rheumatic cases. Now, the Rhus Tox is also an important remedy in a paralysis. This is one of the best remedy for a paralysis generally after getting wet. So in this particular symptom, we found there is only two remedies, the causticum and Rhus Tox. So the rubric is general paralysis wet after getting. Means after getting wet, if anyone having a paralysis, we can use of these two symptoms. That we know that the causticum is having a slow growing paralysis, but in this scenario we get the symptom that after getting wet they get the paralysis, in which the causticum is for 3 marks and Rhus Tox is for 3 marks. But there is an also again a important differentiation in both of these remedies, that also in a cases of rheumatic paralysis from exposure to the damp and cold, generally what happens in both of these remedy, restlessness which is amelioration by motion day and night in a Rhus Tox. Means what, in a Rhus Tox patient, generally the restlessness which gets ameliorates when the patient moves around day and night. Means they have to move day and night. But in a causticum person, in a causticum patient, when they having this particular symptom, the restlessness is generally at the night. So this is the differentiating point between both of these remedies. And we found that the paralysis weight after getting, and also general paralysis cold aggravation, means in a cold there is an aggravation of the paralysis, in a cold there is an maybe the elements from that may develops a paralysis in a uh, any kind of person. And in this particular symptom, we found there is a three remedies, that is a causticum, rustox, and sulfur. We know that the causticum and rustox is a chilly remedy, and sulfur is a hot remedy. So we can differentiate on these points also, and we can also differentiate on the basis of restlessness also. Okay, we can also differentiate on the uh, desire aversion. In a causticum, it generally spicy desire. For causticum comes from the kali family, rustox is again a plant family. So we can differentiate these remedies from their particular symptoms. Now in a skin level, in herpes zoster, the rustox is a great remedy when it present with a neuralgia. That I have seen the many cases when I am practicing with one of my gurus. He used to give rustox very firstly in a cases of herpes zoster and in a cases of herpes with a neuralgia. I have seen that the patient feels very better after using a rustox. In a next day they feels better about 60 to 70%. So this is again an important remedy in a cases of herpes zoster with a neuralgia. Now there is again a symptom that the fever blister around mouth. So I have also seen these cases when we use rustox. But in a cases of fever blister, we must have to use the lower potencies. Means the 6C, 12C. We can use these potencies in a cases of fever blister to get a good result. Now the some another characteristic about the herpes is herpes alternating with asthma and dysentery. This is again an important symptom. We may found in the rare cases that the herpes get alternates with the asthma. They may get alternate with the dysentery. Chokes easily while swallowing. Swallowing causes pain in the middle of a chest. Actually, this is not a chest; it's a back. Okay, so this is a back. Means what? While swallowing they get pain in a back. There is a symptom back pain general swallowing on. We found there is only four remedies here: causticum, rustox, kalikab, and raphanus. Okay, one of the marked symptom indication to stretch and cracking the affected parts which ameliorates the symptom. As we discussed already that the person get ameliorates his symptom by cracking the joints, cracking the parts, cracking the uh, affected parts. Okay, there is one another symptom, there is one another thing, is that stretching also ameliorates the symptom. We found that stretching also causes the pain, stretching also causes the diseases in rustox, but in the same case stretching ameliorates the symptom also. So we found this both the modalities, both the two end modality, means positive end also and negative end also, means stretching also causes the problem and stretching also resolving the problem. In this case we found the rustox is a good remedy. Now cough is excited by a cold drink, means what? If the patient is having cough, cold, coryza, in a cases of cough they get excited by a cold drinks. Also we found this symptom in a silicea. But generally all the symptom of rust considering respiratory are aggravated in a damp weather, cold places, or after getting wet and cloudy weather. But the contrast symptom in this case is a cough which is get better, or cough which is ameliorates after cold drinks is a causticum. Okay, so this is another important symptom. Now the sweat of the body and head is dry is a Rhus tox. Means what? Body gets sweat and head is dry is a Rhus tox patient. And when the sweat of the head and body is dry is a cilicia patient. Means we found that this cilicia patient skin is generally a dry skin and the head is generally a sweaty, the perspiring. In a children we found that the in during night that the head is full of sweat, the head is full of perspiration and body is generally a dry. But in silicia there is another symptom also, that their palms and soles are get sweaty and this perspiration is generally a cold perspiration. The opposite to that, in a nitrum moor we also found this symptom that the hands and palms are get not hands, there is palms and soles are get sweaty and this perspiration is generally hot perspiration. We found this symptom and we can differentiate on the both of the things. Now there is one another important symptom here, that the hypertrophy of the heart exertion after. This is an important symptom we can correlate with the athletes, that the chest hypertrophy heart athletes of uncomplicated means what? In इस केस में क्या होता है कि when that particular person get overexert his body, and after that due to this overexertion their body needs a more blood, and due to that the heart get hypertrophied, due to that heart gets stronger hypertrophied, but this case is uncomplicated, means there is no abnormality in it. Due to the heavy exertion the heart get hypertrophied, the heart get inflame not we say that the muscles get more stronger. So in this case arnica, bromium, causticum, rustox and thyroidinum, these are the important remedy here. The rustox is for 2 marks. The bromium is also one of the important remedy given by Allen. Okay, so this is again an important symptom here. Now the mind symptom, that the fear of being poisoned, suicidal mania, want to throw himself into a water. So the fear of being poisoned is again an important characteristic symptom of the Rhus tox patient, that they continuously thinking that someone uh, gives me a poison, or like that they have a continuous threat that they don't trust easily on the other person because this particular fear. Now there is again an important symptom that I have found in a many patient, that the mind fear superstitious. The only remedy given in a materia medica repertory is a Rhus tox. That दिस सिम्टम मीन्स हम बहुत सारे पेशेंट देखते हैं कि वो कहते हैं कि सर हमारे यहाँ एक पर्सन की डेथ हो गई, उसको अटैक आया और उसके बाद मुझे ये प्रॉब्लम चालू हो गई एंड मुझे लगता है कि वो बीमारी मुझे भी होगी या वैसा मुझे भी होगा, मैं भी मर जाऊंगा. सो दिस टाइप ऑफ फियर इज कॉल्ड ए फियर सुपरस्टिशियस. Fear superstitious means what? If the another person gets some disease and they get any problem with that, and we think that we also get the same type of disease and we also get the same type of problem, and due to that the certain anxiety, certain symptoms develop in our body. So in these cases we can use a Rhus tox as an important remedy, as a very good acting remedy in such cases, if the other characteristic gets matched to the this remedy. Now other symptom in this particular point is a tension in a knee as if tendon were short, and heaviness in the legs especially in a hamstring and a calf. Means what? Tension is a particular type, that stretching, there is a drawing in a tendon, that as like they feel that the tendon is get shorter, and the heaviness in the legs especially in a hamstring and calf. Okay, so these are the important symptoms in relation with the Rhus tox. We found that these symptoms in many of the patient of the Rhus tox, these are the common symptom and the characteristic symptom of a Rhus tox we found in a many of the patients. So on this basis we can easily prescribe Rhus tox to the many patients, even if there is an any pathology, either it will be a avian, either it will be a spondylosis, either it will be a osteoarthritis. So these are the many cases If this type of modalities we found in a patient, if this type of symptom we found in a patient, we can easily prescribe the Rhus Tox as our constitutional remedy. And in a cases of arthritis, in a cases of rheumatism, remember that the modalities plays very important role in curing the patient. So if we take the modalities on a deeper level, if we take the modalities in a good manner, we definitely get a good remedy, and we definitely get a good result in a rheumatic cases also. So this is all about the Rhus Tox. We will again discuss another remedy in a next session. Till then, bye bye, have a good day.